Thanks for joining in. I'm Vukosi. I'm at the University of Pretoria. Unfortunately, I am at the university. I had an emergency at home that I had to come here, but I can't show you too much of it. But this is our campus. This is one of our new campuses that is on something called the previous experimental farm. Now it's called kind of Future Africa, Innovation Africa. It's very nice. It's a mix of a kind of a university campus and also a nature reserve. So there's parts of the campus that the university cannot build on just because of the biodiversity that's on there. And there's a couple of other interesting things. And this is kind of a Pan-African center, bringing in researchers to really work cross-disciplinary and transdisciplinary. And it's my second home on campus outside the computer science department on there. So I will, on my side, give a presentation, and then I guess we can then do Q&A on there. I'm going to try to keep to about 30 minutes, so that we have kind of more than enough time really to chat. So yeah, I'm at the University of Pretoria as a industry chair of data science. It's not a department chair, but a position, a research position. And in also this time of COVID, I am on the COVID advisory committee for Gauteng, which is the province or state that I'm based and the university is based. So I've sat on there. I've also given kind of inputs into different kind of health interventions that in the government people have been trying to do. And through the presentation here is mostly to take you through a practitioner, like, a data scientist practicing in a pandemic, or what actually happened, and through the lens, in this case, of open data and why open data actually became very important very quickly, and still things that we haven't sorted out on there. Last week, I was giving a short talk with my collaborator at Boston University to the African Investigative Journalism Conference, and they were mostly talking about kind of the role of visualization in COVID. So there's a bit of, in this presentation, I updated some parts that have to do with data science, just thinking about some of these things of kind of visualization. Let's try to reduce this. It's a little bit easier on myself. Okay. So I'm just moving one of the Zoom boxes out of the way. Okay. Yeah, so at the university, I lead a group called Data Science for Social Impact, so DSSI. This group was formed about over 2 years ago, mostly working with two parts being data science for society, and on the other side, natural language processing and machine learning. So 60% of the work that we do is on the right, and then on the left is, sure, you want to do machine learning, statistics, math, all these things, but then what are these pieces that actually allow it to be impactful in society? And we try to answer those questions. Some work that we've done in these spaces that maybe bring the two is kind of analyzing tweets in elections for South Africa for 2 consecutive elections, and seeing and also understanding news articles on that part, and seeing what we can extract from there. We've worked on things like cyberbullying and cyber safety. A paper at the moment that's still going through some journal review hell over a year, but we're still continuing in using kind of more work in investigating explainable AI and NLP in this space to understand behavior. And one of the biggest projects we've had is working with the government of Sierra Leone in West Africa and trying to understand kind of factors that impact education using machine learning. And I've also spent some time, as well as my student Henry here in Freetown, working with the Directorate for Science, Technology and Innovation in Sierra Leone. And right now we're also interacting with the Ministry of Education. So my talk today mostly will be around COVID-19 ZA, just as as what project that we worked on. So basically we go back in South Africa, I think March, the first week of March. That's when we had our first inkling that we're going to get our first case of COVID locally. And what had happened is that 2 weeks after this first case is announced, we had one of our lab meetings, which I think probably was in this facility here, and our last physical lab meeting. And some of the group members asked and said, what is it that we could actually be doing to assist? So the needs we identified at that time is like, how can we have all the COVID data that's about to like going to be a deluge be in one place? Can we make sure we can collate and verify it? We want to also reduce the chances of error. So the way that we decide to use this, like, to gather this data is going to be important. How can we prepare a foundation for other researchers and innovators to build on? And can we make this open? One of the things we did very early on at that time is choose to say we are not going to be doing any predictions of the spread of COVID. This is very important for us. It was to stick to a focus of making sure we can collect data, try to visualize it, and then make it available to other people, especially modelers. So to do that, it's a very simple process. We get a public official release of COVID-19 data, see what other data might have to be connected to it, extract this information, put it into a machine-readable format, and put it into a repository. In a way, what happened at the beginning, still happening right now, is mostly from government side. We just have these statements, these media statements that they release on a daily basis. They provide mostly these kind of cumulative counts and maybe a new case information about yesterday and today. So these were coming either from the Minister of Health in South Africa or from some of the provincial bodies, like we would call them MECs of health. On here, we have a website that's run by the government, which basically just takes this information and puts it just in HTML, basically. And then also we have the National Institute for Communicable Diseases, which would be similar to CDC in the US, that also then provides all these reports that are sitting on their website, all in PDF, that nice format. And we had to then figure out how to get all the information from there. So what happened is initially we had these briefings from the minister. At the beginning, for the first 300 cases or so, you would get basic information about a patient, a positive, who tested positive, like their gender, the age, the likely way that the transmission actually happened, right? But then as the explosion of cases happened, then there was a problem, right? As I said, we did no modeling. There's people inside South Africa. There's Sakima, which is our center of excellence in modeling for such things, and epidemiological modeling. And you have UJHEO and UCT. These universities actually had groups that did this. We just wanted to make sure they have the data as they need. What we did then is build this kind of repo that's on GitHub and it's accessible, that has data that at the beginning you had the individual cases there, the individual deaths kind of were there, and then over time it's also cumulative. And we made it open by default. And this was a choice to make sure on one part by making it an open data project, a community could come up really around it. There was a lot of, at that time, we went into lockdown, everybody was sitting at home, you weren't allowed to move around, and you had all these data scientists across the country, just saying, oh, what can I do? So people could come along and actually work and find ways to put this data together. We made sure that the code also is open source under the MIT license, so people could write things. There were people who built scrapers, people who built little tools for people to use, and then we made that kind of available. At the moment, I think we're over 50 volunteers that have worked on this project from the beginning. Some have slowed down, some are still growing and updating kind of on a daily basis. There are still kind of open issues on the GitHub discussion for people to actually discuss. And as we did this, features got added. There was an API that was built by one of the volunteers, and that's still going. And I think there's a couple of APIs for people to be able to hit this. I know, for example, services such as our World in Data use our data for testing. That's where they get the data, because even today, unfortunately 6 months later, the South African government does not have a data portal where you can get all of this historical data in one place. So people actually use this repo kind of to do that. So we then went on to build dashboards as time kind of went on, just to show what you could do with this data on that part. And the dashboard, was an evolving thing over time. We knew that you couldn't keep it static. You had to put new information as time went on. When provinces started reporting, we also then put information that actually then came from these provinces themselves. There were a couple of breakdowns, just so this is more the practitioner of data science. When you're building systems and you want systems to be resilient as they're being updated, remember that our data was in CSV on the repo. We then at the beginning, we didn't, there were some things that we didn't know at that time, and we used some fancy connector to connect the CSVs to the Google dashboard that we built, and that broke down, right? And in a way, some other ones where our minister statements also started getting kind of long. So somebody then built up a scraper at the beginning because we had this individual information. So that's like, automate as much as you could, but then still, even today, like, it's mostly done by hand because things change in kind of the statements. We could run scrapers for only so long, and then they would actually break down in a way. So at the beginning, it was very nice. You can see here, like in March, you would have these very nice ways of just getting a scraper and then getting the new data, then being able to push it to the repo. The traffic did kill us at the beginning as we had the CSV read issue. And what we found out, just FYI, it was actually better if you're working in Google Data Studio, create an import from CSV into a Google Sheet and then connect the Google Sheet onto your Google Data Studio. And that resolved everything. We've never had a problem now for the last 5 months when it came to this. So when we had this failure that happened because of this other fancier way of doing imports, right? And then now you got these, these nice messages. This is from one of my friends and colleagues saying, hey, we now don't have any more information about South Africa. What do we do? In a way, right? So we use Google Sheets, and this kind of came from some of the volunteers who noticed this. And then this became kind of a much easier way. And it's even today we're doing on. I did talk about the API that we built on. And from there, as we keep on doing this, you could put new things on the dashboard. I'll provide maybe some information on there. Let me see this thing. So on the thing that you should be able to see now, this is kind of the repo. The repo in itself has kind of a good structure, which is explained that you can go through. Then there were many things that were being saved in here. The most active files are these, at the moment, cumulative information. We no longer, as I said, for the first 300 cases in South Africa, we did have some information about each of the cases. Now it's mostly cumulative counts. For the first about 100 deaths, we also had information. Now that's kind of gone in a way. So the cumulative data is the one that's being used a lot, and that's updated. You can see the last update was about 10 hours ago. But there was other information that was made available here so that people who were working on either their own dashboards or doing analysis or doing modeling. So there's official statistics that come from our statistics office here in South Africa, which is also very nice because we put in things like the population estimates that they have. You would get after they release new population estimates, got a nice email late at night from the Statistician General's office asking if we could actually update the and use the new projections that they were using, and we uploaded this and then made them available for people to actually be able to use. We do have things like that we calculate. So we calculate the real-time R for all of the provinces and nationally, both using an MCMC and then also another Bayesian approach. So there is a bot that runs every time there's a commit that actually calculates that and makes that available as well for other people. We do at the moment automatically also keep track of the Google mobility data. There's a couple of researchers who are working on that. So the last update was actually 9 hours. It gets updated every Monday, so on a weekly basis. So that information is there. There's a kind of a lot of people who are looking, and we know at the repo and actually using it. I do know, as I said, some of the modeling groups have been using this for a while, and that's something that we're very happy that they've been able to. South Africa also, what we did is we launched a WhatsApp, so just a chat application page for the government, and we could actually extract even some data that came in from there. We don't use that as much anymore, just because of having the now COVID website that comes from the government on there after that. About 3 months ago, 4 months ago, we also had a lot of emails that were coming in from people either querying something, asking for data, or then asking for a change that they wanted to see on the website. They talk about the real-time RT. The thing that's kind of interesting that's still going on even right now is because there's been modeling that's been done. I'm pretty sure for a lot of you, you've seen the many archive papers or the meta-archive papers that have been on there. And what we wanted to do was look at some of the work that came out from UMass on building kind of a model hub where you can provide as many of the models that actually were being used in South Africa and put them in one place. So we do have statistical modelers, machine learning models who've been working on modeling the spread, and now some of them have now started making available some of kind of their code. And then through that, we can build up this model hub. For people who don't feel like they want to put their code in, they can also just run their predictions and then make them available. So in here. If you go to Model Hub on the repo itself, you can also find that there is an explanation of how we kind of designed this, and you can then go also look at some notebooks. So, for example, this Bayesian inference model that was done by University of Johannesburg is kind of available. I know I'm just doing a live demo with it. Okay, there we go. Sorry, with the Jupyter notebook, sometimes it doesn't work, but it goes through that. It shows you how to use the data that's inside the repo. So you can see that it's what's pulling. And then from there, actually running your model with predictions for, I think it was 2 weeks ahead on that part. So that's available. I will just try to skip to this now. And again, try to so as I said, we did then, just to show people what was possible at the beginning, we created this dashboard that just uses the data that's from there, and it's updated basically every 24 hours as the data comes in, and you can actually see what's been going on nationally in terms of cumulative tests, the daily kind of deaths, the cases, the tests performed, the case finding rate. For information that came from our NICD, they have these reports that are surveillance reports. We then had some people who actually gone in and started reading inside them and actually extracting the data. So this data would not necessarily be available for people outside NICD. So we made sure that that's available for everybody. The other thing, as I said, with having provincial information, then we were able to actually look at that. So one of the things that's interesting, if you were to look at this, if you now evaluate it per province per capita, or in this case per thousand, or like how many cases per 1,000 people, one of the things that you notice in South Africa, we've gone on, we were at a lockdown level 5, which was the most severe in our country, now down to level 1, where mostly people are out just doing social distancing, wearing masks. But you can see for 2 provinces here, they have they have different patterns to the rest of the country. And this has been the thing of trying to highlight that we still have to stay vigilant, that these changes are very important, that we can still do track and tracing very well on there. Then, that's just one view. You can view that. And the last one is that you can choose one of the provinces and go inside there, and you'll be able to actually see the district information. Some of it is slightly lagging, because either data source at the moment hasn't been updated, but you can also then look at the real-time reproduction rate over a period. So the thing, obviously, that we're now worried about are these oscillations that are going on, and that we might then be going back, starting a second wave very soon, as it were. Let's see. All right. Okay. We've had a lot of, because this became an open data project, what happened is that there was a lot of developers, data scientists, modelers who get on and started building tools on top. From UCT, somebody built this, one of the volunteers built up this map that was available, and then you could see cases per district as we captured it. Sorry. On there, a couple of people, including one of our volunteers on that team, worked to actually map testing sites in countries. So this one had, I think, South Africa, the US, and a couple of other countries, in Switzerland also as well, was available kind of on there. We've also seen very nice kind of localization. So in South Africa, we have 11 languages that are official. So English is one of them, and there's 10 other ones. So people then started creating these dashboards that were in then local languages that then were pulling from our data and allowing them to communicate. So this one is in Xitsonga, which is my father's language, and then this is Chivenda. And again, it's not like we didn't need to do it, we just made the data available, and this then allowed on there. Some of the media houses as well are still pulling the data from there, and actually trying to enhance and add other things. I think, for example, Mail and Guardian has even worked now to we've now had public releases of contracting data. So contracts for supplying personal protective equipment and all those things from government are now becoming available. And they're also now trying to follow the same thing and making that data also available in an open manner. So what's next? This one is a kind of a misnomer. At that time, when we were going for our first peak, really, of over 10,000 cases a day. Remember, South Africa has about 40 million people, as compared to the US, 300 million plus. So 10,000 was a lot. We were trying to figure out how we could assist in making sure we understood the capacity of the health system. So we then worked together with a couple of volunteers to build the first open machine readable health facility data set of the country, both for the public institutions and private institutions that were on there. That data became available. Other people have been using it to build on. And from there, what it also had through digging through people's PhD theses, we found that a couple of students had actually worked to try to figure out these estimates. Then we provided that information available. We do have a tool that's available now that you can use to go to. And we also have a paper that covers this, which is the mapping of South African health landscape. That was part of the KDD workshop on humanitarian mapping. So you do have access to this map if you want to go to it online. So I share, yeah. And it's through good, some nice support from Google Cloud platform, as well as the International Astronomical Union, who also has provided some funding for one of the volunteers to actually be able to do this work as their main work for a bit. So you could go and click on the hospital, and there will be some information that actually comes in of that. And this is again to show what's available in those CSV files that were actually compiled by our volunteers. And then from there, you can then add on top of that. To see it's finishing. Okay. I did talk a little bit about the Model Hub. That's still going on. I'm hoping with our statistics department here at the university, we will have access to more models as time has kind of gone on now. There is, when working in data science, especially when you're doing things like modeling and prediction, it is a very unfortunate thing that if you do not communicate correctly what your models are doing and how they do it, and people might take it in kind of the wrong way, and then this becomes, you move into the realm of politics kind of in a way. And as such, for a lot of modelers, this has been something that they try to stay away from. Like, I don't want to provide my model because then I might be quoted somewhere and it's not something that this was actually trying to do. So I think right now, because we've gone through our first peak, people are slightly more interested in sharing their work, and we'll see what we can get to by early next year. We've also been working on doing social media analysis. I teach natural language processing, for example. So we're now looking at how the coverage of COVID was in South Africa and what can we learn over that. We do have kind of a paper on archive at the moment and trying to look at social media and trying to extract what the main discussion points actually were. This work is currently kind of ongoing, so we will keep on adding to that archive paper. We did have a project, COVID-19 Africa, to try and do the same thing across the African continent, but this was very tough. Now, one being, sorry, I just wrote a blog post last week, it will be out soon, on this of, we had countries that were responsive, try to make data available in the best way that they can, and also look to data for decision making. And hopefully use the data for decision making, not just to say they were using it, but actually they were. But you also had challenges of dealing with kind of misinformation that was going on, and then also dealing with some places, countries, or even provinces or areas that did not provide any information because of politicized. If you have a country like Tanzania, where almost early at the beginning, the president said that they didn't believe that COVID actually existed. So in that case, you had almost zero chance that the data was going to be available. I think this highlights some of the kind of challenges in providing data, that it's not simply we think it's a technical thing, but sometimes it's politics. But then also the reason that there's no data in some places, it's because there's no good pipeline to provide this information in a repeatable way on that part. So for us, the lessons we learned, you can't really do good modeling without good data. Public data should be public, right? Minus, hey, keeping people's information private, that needs to be private. But we should have ways that the government, the private sector, the NGOs can work together in this case. And we found that some of the challenges that we're seeing with putting these things together were really because there's no good governance, data governance that is allowed, right? And we should also find ways kind of to work together. We needed to get ahead of this very early. I think the only reason that the repo still exists is because we started 2 weeks after. It would have been really, really taxing if we had started a month later on that part just to build this on, right? And there's still this question of what is it that we don't know at the moment. We are in this very slow time. Cases are between sometimes 800 to 2,000 a day. but are there things that we're not seeing, right? And yes, I think maybe one of the takeaways for you in this class is data is political, right? In small ways, you get little nice bouts of hate mail sometimes. Even as a professor at a university, not really connected with just we're just working on providing the information and always making sure it's available. And then it kind of sometimes some people do not wanting that information actually to be available. Unfortunately, in the US, we did see sometimes, like in Florida, I think there was somebody who's working in information visualization who was fired because they were refusing to change the visualization on there. In more specific to South Africa, what we saw is that public institutions had really bad procedures on working with those with outside. I myself, having to work for a province, had to spend weeks going through NDAs, agreements between the university and the province, and still, even after that, being asked to fill in even more kind of a restrictive contract, these agreements that said data really count. But even after going through that, the data we got access to is really not enough for us to actually assist in helping in decision making. So I am myself, I'm seconded to the Gauteng Premier's office, so you can take it as the governor's office on there. And then my PhD student is seconded to another province, which is the Free State, and working with them. So through that, some information we're able to make sure we made available. The Free State has been great. They update their own data on the repo instead of having to have volunteers do it on there. And the health systems also need better ways to work and share data. We have this issue, if you work in data science, you'll notice when you work in organizations, you might have organizations that have really gone through that data journey. So you have 100 systems, and each of those 100 systems have their own 100 protocols that they use, and they don't interoperate. So that's one of the things that we're still today, that is unfortunate, but 6 months later, that is still something that hasn't been resolved as yet. So I'm having to sit on committees to assist in actually now, giving advice on how these things should change over the next few years on that. We need to have kind of clear open data portals on there. We need to train civil servants on how to best use and share. And there has to be data governance that balances between availability, use, security, and privacy of citizens. And there needs to be this kind of work of collaboration. In terms of resources, I think I did share some with the professors and the teaching assistants on here. Really, I think the data in the time of COVID is a very nice resource, and it actually shows in some ways also the temporal changes that actually went on with us and looking at open data over time. So yeah, with that, thank you. And I also want to thank there's way more volunteers than this have been working. We do get data in different ways, sometimes even through WhatsApp, sometimes through email, and we do make it available. And the project still keeps on going. And unfortunately, we now just need to kind of brace ourselves for this next bit of the pandemic in South Africa. So thanks.
Yeah, thank you so much. Can we put our emoji hands together to thank our speaker?
Thank you.
Unfortunately, no applause this time, but it's our best we can do on the Zoom world. So we have a group 5, who's prepared some questions for you, but I also want to encourage anyone in the class. This was a very interesting talk. If you have a question, please unmute your mic and speak up.
Okay, so I might go first. So first of all, thank you for your presentation. But I saw that through the infographics we can see that you showed, we can see that the data collection many times is separated according to each province of South Africa. So I wanted to know if you have been able to connect those results for each province to a socioeconomic factor that might be causing one province to be better than the other.
Okay, that's a good question. I'll try to answer. So one of the things that happened in South Africa very early on, I didn't talk much about it here, is that we have 3 organizations. So one being the Council for Scientific and Industrial Research. It's basically akin to the national labs, but in South Africa. They had a vulnerability map on health and socioeconomic factors. They produced just to show places where they thought might be at higher risk if you then start having community transmission. That was one. The other one was the GCRO, the Gauteng City Region Observatory. So it's here in Gauteng, and they do the same thing. And I think at the moment they haven't really released any direct information to say, yes, we found that there's these correlations that were very big. I think they're still digging into it. There were things that obviously were expected. So in places where people were more poorer, if you look at mobility, even going into lockdown, like, very quickly, because you're very poor, staying at home doesn't really become an option, right? You have to find a way to get some money so that you can get food. So those places, I think, in some ways moved out of a lockdown faster than anywhere else. There are some places that are looking, especially at when people went like shopping, and specifically where, like, and also taking public transport, in terms of did that then impact the way. So there's some work that we're doing with one of my collaborators on that. They're looking at those things at the moment, but it's too early to tell. I don't want to say yes, it's exactly the kind of, but one of the things I could posit about, I showed the provinces that have continued going up even after the rest of the country has gone down. Those places are more sparsely populated. And what has happened, most likely, in my view, is now that we have more open movement, people who are in areas that actually had COVID are now moving to and back from these areas, or the people who are living in these sparsely populated areas are actually going back and forth. And now that's how it's spreading into those areas.
All right, I had another question. It's a little more general, but essentially, on your website, you talk a lot about kind of using local projects to kind of look for the use data for social impact in that way. COVID-19 obviously is a much larger problem in a global sense, so I'm sure that kind of presented, more data available to you to incorporate into your research. I guess my question is, with it also being a more politicized issue, unfortunately, did you find studying COVID-19 to be easier than a lot of these local projects with the increased data, or do you find the increased political issues making it harder to kind of get accurate research?
Thanks for that question. Yes, I've been working in the data science and public sector work, or civil society work, for 5 years, and that's the reason I ended up forming this research group at the university, was to say, I understand we can do machine learning and AI. I love it. That's my every day I'm reading papers, but there's this missing piece of how do you actually make it useful. And that's a very hard thing to do. Like, we tend to think about it like, oh, we'll write the paper, and that's not how it works. And it's also not simply, oh, the startups or the private companies will do it. There has to be a way to actually engage with people in government on that. And through that, I've gotten a lot of gray hairs. So what happens is that you do projects in that space, you don't have enough data, or you do have data, but there's no political will. So you solving the problem doesn't mean anything. It's like, you solved it, but nobody really cares. And this is something like with my students in the past, I'm like going through and also training data scientists who showing them that. And also then having to talk with ministers, with people in this space, and saying like, oh, we have to prepare ourselves because there might be something that happens and we're going to need all of this skill. And we haven't really done that. So the funny thing then about COVID-19 is now that 5 years of pain just became like very easily everybody now is asking you, so what should we do? Where 5 years before, you were always being ignored, right? So it's like, what are the things that we're supposed to put together on that? So, I mean, as I said, these committees where we're sitting going like, here's how you change your data policies. Here's how you change the infrastructure. But these are the same things that me and my colleagues were saying 4 or 5 years ago, and we were doing it. And it's a hard thing because you have to keep on pushing against, this wall over and over and over and over again. And just saying I'm not going to give up, because if you do, then you can't respond to a pandemic like this, kind of in a way. So that's the opportunity that it's given us. The headaches haven't gone away. We're now just more intimately dealing with these challenges. So they are no longer being seen as just being, oh, it's a nice to have, or we don't really need to think about it right now. So we do try to be very direct. That's one thing I've learned now as a scientist, I think, over this process is being in some cases euphemistic or trying to soften the blow, it wouldn't help. People are dying. So it was direct, be like, this is missing. If we don't have this, you can't make these decisions at all. Like, so this has to be done in the next week. And if it's not, you then call it out. You don't wait and say, no, I don't need to say this right now. So that's been kind of the very big difference for me.
So I have another question. Again, thank you for coming out here and talking to all of us. So you're working with a lot of data, many of which is publicly sourced. So I was wondering how you determine the credibility of your data.
Sure. Good question on that. Yeah, we do this in two pieces. So in our one, the data that you see on the repo is only from official sources. So you can actually track where it came from. Every line in the CSV has a source that is actually attached to, and you can go check where it comes from, mostly coming from the official Ministry of Health statement, or it comes from the NICD, as I said, is our version of the CDC. We didn't allow anybody just to come in because they thought that they were going to put something there. So even in the health facility map that we created, that data came from initially what we is called the data dictionary from the health department, and then it was enhanced with other data that's on there, and that whole process is actually documented. So if you find any data source and you would like to query it, you will be able to find the trail. So there is, it is not, that was a decision we make at the beginning, because in the first few weeks of COVID in South Africa, we had this weird thing that was happening of people going like, oh, like a journalist went to some neighborhood, interviewed people who said that they felt that their daughter had COVID. And that somehow would then make it into the Johns Hopkins dashboard as a number that was added in. And you're like, how? Like, you know, that brings up that question of like, where's Johns Hopkins getting their data? Right? You know, because this wasn't official. This wasn't in any way confirmed. It was just somebody said it, then another data source then added this +1 because they said that that person without any test had that, and then it propagates across. And that's the thing, and that's a good question that you're asking, because you need to ask that of any project that's going on nationally or internationally, of where does the data come from? Because there's still a lot of errors that are making it into very big data sources at the moment on that part. Sure, maybe at the beginning that one swayed the numbers by a lot, so you couldn't, like, the pattern would change a lot. Today it might be less, but we still have to be vigilant that we actually do kind of look at our data problems.
Good morning, Dr. Marivate. I had a question. So I was wondering how the API sort of draws on the data to compile it together. So in that sense, are there certain programs necessary in place in order to distinguish certain data files that it draws on, so it doesn't get compiled with other data? Or
Yeah, it's a good point. No, the data sources it uses are only from us. We do not access any other data sources that come from the ones we've compiled. So it's very easy to know that it comes from you. Yeah. Yeah.
Okay.
We did that. There are projects that have tried to do that. We've worked with like Oxford University. They've been building like a international line list that puts as many of the line information into one place as possible. And then those ones are APIs that then you have to take care of every connection. So with our World in Data, which is a great website, if you like, you know, they do a lot of research, you will see that they have on their repo one file that goes through all the data sources from every country that they use. So we are listed there, and then that's a way that if you were to query them and say, where do you get your data to put these very nice kind of graphics that they have on there, you can actually track it. But that's like one of the few, for me, that's the kind of the top tier in this space.
So then my follow-up to that is, so knowing that you have your own data set and they're all filed in different places, does the API draw on those files separately, or is there a program instead that sort of divides or compiles them together based on how they're sort of described?
At the moment, we try to keep to just individual, so you have endpoints that just says, are you interested in testing? And it hits the testing file. Are you interested in the confirmed cases? It hits the confirmed file. Are you interested in the deaths? It hits the confirm, like, you know, the death file. It does. So in that case, you don't need to really mix anything. So the stuff that needs to be pre-calculated, like the real-time reproduction rate, that just runs every time there's a commit to a few of the files. And then that becomes a static file that's available as well. So we don't have anything really that's dynamically being compiled and sent to a user. All the files are static. It's just that we know that there's people who just want access to an API for whatever reason. We have modelers who might need an API that they call multiple times on that part. But basically what you get in the CSV is likely the endpoint that you get in the API.
Thank you.
Hi, thank you for your presentation. It was really good. Okay, so I noticed that in your slides you showed that you have like many resources, like many platforms where you share like information on COVID with the public. Like there's the website, and then there's also the WhatsApp. Have you noticed like any of those having like more traffic than the others or anything like that?
Oh, so that's more kind of the Department of Health in South Africa. But I can talk anecdotally, so I don't know what their current thing. So on our dashboard, we know it does get like, you know, every dashboard has its diehard followers. So those people stay on. We've had good times, and then there's a drop off, right? Because right now there's that less of that fear that's going on. People aren't checking anymore as much, so that's gone down. The WhatsApp, I believe, also from government is likely low utilization at the moment. At the beginning, probably it was high because that was an easy way to get this information, but now it's probably gone lower on that part. The other things that we do have now through the Google and Apple APIs is we have the contact, the alert app that you install on your phone, and it uses Bluetooth tokens to kind of keep track. So even that, I would also tell you that most likely the utilization is low. It is like in every country, you have the same kind of challenge where the cases start dropping off, the daily new cases, and people come into this false sense of security kind of in a way. But during, like, you know, I know there's a website called Worldometers, and I'm pretty sure that probably website in the world probably got some of the craziest hits in there, even though it has errors and it has really atrocious advertising that's on there. But it was this one place where you could easily see countries kind of, and the same with the John Hopkins kind of dashboard at the beginning. In South Africa, I would tend to think the ministry website where it just shows this like table is likely the one that gets the most hits every day, as it were. For us, that was not the goal, is to get on that. We're more communicating to other researchers, if that makes sense. Because it's like, hey, here's the data, and here's how you can understand the data, and then you can use it. So there's papers already that have either been written, there's modeling that's been done that uses the data that comes from our repo. So for example, I'll try to share one more time. On the kind of, on the repo itself, you can kind of scroll down towards the end and you will see projects that have gone on that are connected to these. And then, sorry, I don't have a slide on it. Then there's also, let me see if I can find it. Yeah, so like, for example, there's these modeling kind of websites that have been going on, and then you can also get these out. So they are available, and they've been made available to other people. So we weren't here kind of to make it as no way a one-stop shop, but to the public, but then mostly we were communicating to other researchers, data scientists, and saying, here, it's available, use it. And you can probably do way more than my research group can do, right? That's not the point. That's why we made the data.
Makes a lot of sense, thank you.
So I guess this is more of like a cultural question, but I know that the US has struggled a lot with public trust. What is that like in South Africa?
I think it's somewhat like, okay, it's a good cultural question. I spent 6 years in the US, kind of doing my PhD, um, and at, I guess at that time, so 2009 to 2015, I was thought like, the US is a very, in some ways, there is some good skepticism of the government, but then there's a trustworthy, there's a big trust in some public institutions. In South Africa, given our more recent history, so let's say the last 30 years or so, there's a very normally big distrust of government, right? Because of where we've come from as a country, right? We had a government that was really being very oppressive before we got into a democratic dispensation. So that's taken time. But at the same time, and then that's the reason why we're doing this work on analyzing traditional media and social media, was at the beginning of COVID, because the Minister of Health was very forthright, he was on TV almost every day, every night, he had these briefings on there. We think at that time there was a lot of optimism and trust, right, of the national government saying like, oh, this is great stuff. They're telling us what's going on. There was a, like, hey, close down the country. Almost like anybody you probably would have asked in South Africa, like, should we close down travel? Yes. Have you seen, like, everything that's being given by the government and providing us with information? So close it down. But as time went on, I think, especially to the question about like the socioeconomic factors, like once we did a full lockdown, you weren't allowed to move. We had curfew basically the whole day. You could go shopping, I think, between like 6 and 9 a.m. and then that's it. You have to stay at home on that part. And people started losing jobs. And then there was a whole thing, if you're poor, poverty. I think that's where that started getting eroded, because then there was this question of saying, okay, you predicted that these many millions, like, by November, these many millions of South Africans were going to actually have COVID. And right now, South Africa is like at 700,000. And the deaths are like a fraction of what we thought that they were going to be given. That's when that erosion started coming in, right? And then you see a lot of skepticism. Every time there's a statement that comes out from, hey, be vigilant, we're still worried. People just respond and say, nah, it's not going to happen. We said there were going to be like 1 million deaths, but they were nowhere near that. What's going on? So I think it changed over time, and we're hoping kind of our research, hopefully by Q1 2021, we'll be able to show some of that like, there was a lot of trust in institutions at the beginning, and then as time went on, it kept on going down, and it probably hit like a plateau and staying there for a while. And this impacts a lot of things. So the alert app that uses Bluetooth, it was very hard to launch that because people were just responding saying, oh, the government now is trying to track your movement, which it doesn't. Like the design of the API and by Apple and Google means that you cannot extract any personal information from it. But people were now like, spreading this misinformation about it. And there's been a lot of that. And I think that's also an indicator because of this distrust of government at the moment.
So maybe let's take one more quick question. I have to let them go to their next class pretty soon, but if anyone has one, please jump in.
Actually, this is Jan Hanek, one of the instructors. I was interested in when you said that you have all these forms from the government. Do you think there can be something good that comes out of COVID, that maybe you can create a data infrastructure in South Africa that will survive the COVID emergency and will be useful later?
Yeah, these are the kind of lots of meetings and workshops that we're having with health officials. And then I think I had to give a talk at the National School of Government that mostly talks to civil servants and what they're doing on there. So for me, my big thing when I'm sitting and I'm giving presentations there is that if we emerge out of COVID and all of that, those things have not been taken care of, then really all the deaths would have been for nothing. All right. Yeah, we at least that we should come out of this at least having fixed these a lot of these things. So even this morning, I spent time kind of reading one of the proposed new data policies for the government and giving my inputs into it on them. So we have to change these things.
Well, let's put our emoji hands together again for Dr. Vukosi. Thank you again for all this really interesting information, actually.
All right, thank you. And yeah, have a good morning.
Thank you.
Good morning.